welcome to Menopause Rescue. I'm Dr. Polly Watson. Midlife women are often caught up in a sea of symptoms. Too often, they're overwhelmed by the lack of support from mainstream healthcare. They're inundated with so-called experts who are selling solutions which may lack credibility. I'm a Menopause Society certified gynecologist with both traditional and functional medicine training. I'm here to guide you through this transition and help you decipher the facts from the fads. Armed with credible information, I hope you are empowered to rescue and restore your health, making the second half of your life your best. Welcome to Menopause Rescue. I'm your host, Dr. Polly Watson, and today I'm delighted to be with Kate Willis, nurse practitioner and fellow comrade in arms at Hormone Wellness MD. We are going to be taking the beginning of a series looking at heart health, metabolic health. What else do we need to be thinking about beside hormones? So welcome, Kate. Great to see you.
Great to be here. Thank you.
So I think one thing you and I both have noticed is that it's great to see all these online resources popping up, particularly for people who are living in an area where they don't have a menopause literate provider. But the way we're thinking about menopause is not just hormones, yes or no, but looking at whole person health. So this is so great. Kate just did kind of a deep dive in cardiovascular health through a functional medicine lens. So we're really going to take advantage of that additional research that Kate's been doing to kind of bring this to everybody. So Kate, maybe we can kind of start off. How does menopause transition affect heart health? Why should midlife women really care about this?
Yes. So I would just, first of all, second, I'm so glad there's more access to hormones, but we are both seeing more and more patients coming into our practice who are already on hormones, and either they don't feel like they expected on hormones, or the hormones haven't fixed some of the other problems that they are seeing develop in midlife. And one of those are changes in cardiovascular and metabolic health. So how does menopause affect heart health? First, we will see changes in LDL levels due to the drop in estrogen. So we have a lot of patients who say, I am eating the same diet and I am doing the same exercise and my LDL cholesterol is going up. And that is really a result of changes in hormone levels, specifically estrogen. We also see lower levels of HDL cholesterol, which is really a protective type of cholesterol. Both of those, the increasing LDL and the lowering HDL, are risk factors for getting plaque in our arteries, atherosclerosis. So that is one major thing that we're seeing happen in midlife. We also, as estrogen changes and goes down, our blood vessels become less flexible and we can get an increased risk for hypertension. And so again, without a change in someone's eating habits or exercise, they'll begin maybe to see some blood pressure that's been creeping up. Another very common thing, that many women in midlife will relate to is change in body composition. So they start having more abdominal fat and maybe even less muscle in their arms and their legs. So that increase in what we call visceral fat, it's that more risky type of fat that is around our organs, usually in our midsection. And it is an inflammatory type of fat that is linked to a higher risk for cardiovascular disease. So those are some of the big things that we're seeing.
The metabolic shift, I kind of call that, I went from an hourglass figure to SpongeBob SquarePants, right? Like not not a fun change. We can definitely work on it, but it's no joke. This change is no joke.
Yeah.
So we've done a really good job educating women about breast cancer risk. I'm not sure we've done as great of a job looking at or helping people understand their risk for heart disease. So Kate, let's just talk a little bit more about that. Why should we be so focused on heart disease now?
Well, I think one of the sneaky things about cardiovascular disease is that it is often really kind of insidious at first. Like, it is creeping. It might show up with increasing cholesterol levels or a changing hemoglobin A1C, or maybe even a little plaque on a coronary artery calcium score. But by and large, people people's lives may not initially change when they get those early signs of cardiovascular disease. Whereas with a diagnosis like breast cancer, boom, life changes immediately. There's surgery, there's treatment, there's chemotherapy. So I do kind of understand the focus on something like breast cancer, which is, of course, we want to reduce breast cancer risk, but heart disease is sneakier in a sense. So I think that's part of what's going on. When we're in our 40s or 50s, we really are not thinking probably about having a heart attack. But the truth is, we are starting to have the potential for changes that might lead to a heart attack or a stroke or some other cardiovascular event in 10 or 20 years. So the menopause transition, the years leading up to menopause and the years after menopause, are really key for preventing this development of cardiovascular disease. Heart disease is the leading cause of death for women around the world. And so, we want to be paying the attention that this condition deserves.
And a lot of the things we're going to talk about today incidentally overlap with, if you're reducing your heart disease risk, a lot of those common things, eliminating or lowering alcohol, exercise, improving insulin resistance, and having better metabolic health also decreases your breast cancer risk. So it's great that we've got a lot of overlap that if you are trying to be heart healthy, you're often protecting your breast. So that's kind of fantastic.
Good news.
So, let's kind of talk to that 45-year-old who's healthy. She exercises. She feels like her diet's pretty cleaned up. She goes to her primary care and she has, quote unquote, normal basic lipid panel, right? So I'm seeing patients come in with less and less labs from primary care. They're kind of getting a CBC, are you anemic or not? A CMP, fasting blood sugar, kidney function, liver function, electrolytes, and a basic cholesterol panel, HDL, LDL. And then that might be all they get. Sometimes they get a hemoglobin A1C, not always, right? We would love to see that. But let's say we've got this 45-year-old healthy female with normal labs, and she's like, I'm good. I don't need this conversation. Why does she need to pay attention to this?
Because there are clues all over those labs about the state of our health. And I would say this, I'll have patients sometimes where I'll order labs and they get the labs back before they see me and they'll message me and say they look like they're all normal. And I say, well, normal doesn't mean that they're in the right place. And it can certainly be indicated that there are some problems starting to emerge. So number one, in a standard lipid panel, we're going to see several things. We are going to see the triglycerides, and the triglycerides are a clue that something is going on with metabolic health. It really is a surrogate marker for insulin resistance. So even without a fasting insulin level or without a hemoglobin A1C, I can get a real snapshot of what's going on in someone's metabolic health. Another thing in the metabolic panel, this may be a basic metabolic panel, a BMP, or a complete metabolic panel, a CMP. If the ALT is greater than 25, we start thinking about potential fatty changes in the liver. So those are big clues to me that something is going on. In that CBC, that complete blood count that is looking at white blood cells, red blood cells, hemoglobin, hematocrit. There's some numbers that look at the size of the red blood cells. The MCV, which is one of those markers, if that is elevated, can indicate that someone is actually overdoing it on alcohol. So again, I think, our labs speak, and that is a way for us, even with a basic set of labs, to be able to tell what's going on with a person or where they might need some additional support.
I love that. And also, just normal isn't necessarily optimal. So one thing you kind of started off with talking about triglycerides. LabCorp's normal triglyceride range goes up to 150.
Mm-hmm.
And in functional medicine, we would really like to see your triglycerides be less than 100. Mm-hmm. So we're often looking at your labs with a little bit of a more rigorous measuring stick than just what is normal versus what is optimal. One thing I think would be really important for that healthy 45-year-old to understand is how many people who have a normal cholesterol actually end up having a heart attack.
Mm-hmm.
right? And so we know that about half of heart attacks occur in people with normal cholesterol. And so, my goal here is not to impart fear in the hearts of all, but maybe to help give women some agency and some education so that if they just get this, like, your labs are normal, you're fine, maybe we need to look a little bit harder. So, Kate, maybe you can kind of start with thinking about, if we're looking at this kind of healthy 45-year-old, what are just some really basic lifestyle things that you want to dive into when you meet her about counseling her about heart health?
Mm-hmm.
So we're even beginning when we're thinking about lifestyle.
Yeah. Nutrition is one of the first places that I'll dive in. And I always want to be mindful that most of us are just doing the best we can when it comes to food. We might be pressed for time. We might not like certain foods. So I don't ever want to be critical or dogmatic with food. However, we have a big impact on our inflammation levels, our cardiovascular risk, our metabolic health through the food that we eat. One thing that I'm seeing is women are really picking up on this high protein push, which is great in many respects. But they're often filling that protein bucket with processed protein foods, or, lots of, a bar in the morning and a bar in the afternoon to get to their protein goal. And they're sometimes doing it at the expense of vegetables and fiber containing foods. And so as we're looking through, we're thinking, what's the whole picture of nutrition, not only for, the metric of protein, but are you getting foods that actually lower your cardiovascular risk, improve your insulin sensitivity, and help with your metabolic and cardiovascular health. So one of my favorite tools to pull out is our Cardiometabolic food plan. This is from the Institute for Functional Medicine. And I love the way that they do this. They provide recipes and ideas, but they also have this list of, the different categories of food. So proteins, nuts and seeds, legumes, fats and oils, vegetables, fruits, whole grains. And they go through and kind of list foods that are supportive in that category. So, and what is a serving size? How many servings is reasonable for someone based kind of on their rough caloric goal? But they also highlight therapeutic foods that are especially good in these, in the cardiometabolic health realm. So, for instance, in protein, things like fish and shellfish are highlighted. And so we think about salmon, sardines, this fatty fish that are really full of omega-3 fatty acids that lower inflammation and can improve things like triglycerides and cardiovascular risk overall. Nuts and seeds, they, list a number of nuts and seeds, but then highlight some really particularly therapeutic things: chia seeds, pistachios, soy nuts, actually, because of soy has some benefit for cardiovascular and heart health. So those are highlighted as therapeutic foods. So I think what I love about this, it's flexible enough to meet someone who maybe has some food preferences, or maybe some allergies, or maybe some intolerances or something like that. But it also really does give specific guidance about particularly therapeutic foods to eat. So I love that plan. I love the recipes that are on it. I think we'll include that with the show notes, but that is a place that I'm always starting. I also am in the tortoise and the hare camp. I'm in the tortoise camp. If someone makes, 10 changes to their diet, they might be able to sustain that for a week or 2 weeks or a month, and then it's going to feel exhausting and unsustainable. So I will often say, hey, let's look at your, we look at someone's food intake. I say, hey, looks like maybe you're a little bit short on green leafy vegetables and cruciferous vegetables. What if you tried to add one green leafy vegetable a day and one cruciferous vegetable a day, for the next month? And you maybe you introduce just one of those at a time and figure out how to incorporate it into your diet. And then you introduce another one. So they are making a small change and building on that change over time to really make it sustainable. So, I don't want people to ever feel like they need to change their diet entirely overnight, but even small changes that are added on top of each other can really make a big difference when it comes, like you said, not just to heart health, but really our overall health. But that is the first place that I start with people. Any thoughts that you have when you're working with patients?
Yeah, I love your very realistic approach. I think you and I both kind of practice the golden rule of medicine, and that, like, am I asking the patient to do something I wouldn't be able to do myself, right? And so I think that's why people really love working with you. I think the one thing that I just wanted to jump in on about the protein and the cholesterol is what the animals we're eating eats matters in terms of the fat content they're giving back to us. And it's super frustrating because food labeling is not fantastic. If you're a member of our practice in the detox series, we have labels screenshotted from the Environmental Working Group website. So Environmental Working Group is a great resource to look at meat labeling and understanding what's what. But the long of short of it is that if you're eating fish, for instance, you want wild caught fish. Farmed fish is not, those fish are not, they're eating, like, I don't know what it is. Maybe it's corn, but it's not what a fish would normally eat in the world. And so that changes the fat content of that animal when, let's say, you eat a piece of salmon. So I pay attention to wild caught fish, pastured chicken, grass fed and pastured beef. If you can find regenerative beef, that's fantastic. It's also much better for the planet. If you're listening and you're around North Carolina, Hickory Nut Gap Farms has regenerative beef. You can even just Google regenerative beef near me. And then another thing that I see a ton kind of in that same, we're all trying to get this protein in, which is fantastic. We're totally supporting you in doing that. Just, is people are reaching for dairy. Like lots of cottage cheese. Oh my God, the Instagram recipes for cottage cheese, everything, right? If it sits still, we're going to put cottage cheese on it. So again, are you getting grass-fed organic milk that's going into making that cottage cheese? And so that might take a little bit more intentional shopping, but maybe it could be a relatively easy swap, buying one product versus another. So I think paying attention to those subtle things, if we're thinking about small changes we could make, I think that would be super important. I'm a huge fan of kind of just looking at your plate. Is half your plate non-starchy vegetables, a palm-sized amount of clean protein, 2 fingerfuls of healthy fat, kind of an ice cream scoop of complex carbohydrates, just kind of going back to the basics, right? When I was coming up, Mama would say, how many colors on our plate? We're supposed to be eating the rainbow. So I love the slow and steady approach because, like you say, it's so much more sustainable and we're all doing the best we can. And the world's pretty busy right now. So small changes add up.
It is. Another thing that I talk about with patients is alcohol intake. And again, this is a place where people have a pretty wide range of what they feel like is normal or what they can be drinking without, having a problem. And, there is certainly a very definite line for many people between having a problem with alcohol and really enjoying it socially. But we want to be really mindful of the health risks of drinking too much alcohol. When we think about alcohol, we want to be really mindful of what more alcohol does to our bodies. There was an observational study that looked at women who were in their mid 40s, and they found that those that drank more than 8 drinks a week had a 45% higher risk of heart disease compared with those who reported a low intake of alcohol. And so we also know that alcohol increases our risk for breast cancer when we're drinking daily and consistently. So, heart disease and breast cancer are 2 really good reasons to be very moderate or, drink very little alcohol to support both of those conditions from developing.
Yeah, absolutely. I think alcohol is linked to 7 different kinds of cancer. Osteoporosis goes up with alcohol use. It's a really interesting conversation because I think a lot of times, particularly with the pandemic, a lot of people were reaching for alcohol to manage stress and they might not have had a lot of other tools. And I'm still seeing a lot of that linger where, when I bring up, hey, you're drinking more than a drink a day. I would like to see people drinking less than 2 drinks a week. Ideally, we'd like people to not drink really at all, but sometimes you got to start somewhere. And I think it's just, we want to find ways to connect with each other without having to add an additional substance. And so it might require a little bit more creativity. I think it's also really challenging for people when that's how they socialize or that's how they relax. And so it kind of goes back to sometimes we're as healthy as the 5 other people we hang out with the most, right? And so we don't want to like trash our friends if that's part of that, but there might be people within that friend group that are also looking to make a change. I don't know. What are some tips you think about when you're trying to help people drink a little bit less?
I think initiating social activities that are not centered around alcohol. So again, you might get turned down by your friends, but you might actually have some people who say like, "Oh, great! Like I'd love to go on a walk, or I'd love to play pickleball, or I'd love to, go out for coffee instead of, out for, mimosas." So you may get some other people to jump on, starting with something like a mocktail or club soda if you are going out, and just sort of nursing that for a while. And I realize that can be tough, but it kind of makes you feel like you're still having a fun drink maybe with friends. And so, being able to socialize and realizing you can have a good time without alcohol, or you can keep alcohol to a minimum and maybe even enjoy the night more than you were. So, yeah.
Yeah, I think maybe it was a couple Januaries ago. I walked in Total Wine and I said, "Hey, show me your lowest sugar mocktail or alternative beverages." And they showed me curious elixirs. They showed me all kinds of things. And I was able to find a lot of things with less than 5 grams of sugar. A lot of them have adaptogens in them, either like lion's mane mushroom or reishi mushroom or ashwagandha or things that can kind of make you feel a little bit relaxed. So that was just where I looked. But there are a lot of options out there so that you can maybe not feel like you're so austere. I think that Spendthrift fizzy water makes it's not a mojito. Maybe they call it a no-hito, but it's basically like mint and lime and fizzy water. And I think it's delicious. So that feels like a celebration to me. So there are lots of there. I think the world is getting a lot more sober curious, and there are so many more options now that maybe you didn't know existed. It might be a fun thing to try. Awesome. So we talked about nutrition. I just wanted to give a shout out. I think one thing you've done an amazing job in our practice. You did a series of classes for folks on continuous glucose monitoring, and so especially when we're having that transition from you haven't really changed a lot and you feel like your weight's gotten shifted around from like an hourglass figure to sort of SpongeBob SquarePants. We often use a lot of continuous glucose monitors to help people see in real time. Do you want to just talk about that a little bit? Because I feel like that's such an important tool.
So, again, I mentioned that triglycerides are a indicator that something is going on metabolically. And so that's one clue when I see that, even if someone feels like they're not eating, high carb or eating too much or eating high sugar, I think that's something to say, hey, what about for your body? Like, let's try to personalize what you eat, and maybe what you're eating would be fine in another body, but for your body, it looks like it may not be the best fit. So a CGM, I think, really helps someone personalize their diet and to see for you what drives up your blood sugar. So triglycerides elevated will make me suggest or recommend a continuous glucose monitor. I'm doing a lot of hemoglobin A1Cs on patients in midlife. And you mentioned that this is not always getting done in the primary care setting. I am often finding women in midlife who are pre-diabetic and they are shocked. So I think that's another place where a CGM is really great. Likely, if they are pre-diabetic, they've had some metabolic changes going on for a while. And so I think the CGM really helps them identify, are there patterns of eating or ways of eating or certain foods that they're eating on a regular basis that really are driving up blood sugar. Sleep and stress influence blood sugar too. And so I think understanding, what's going on in the middle of the night. Some people will say, I don't understand. My blood sugar is over 100 all night long. And so that's information in and of itself that you can't get from monitoring just post-meal glucose levels that a CGM gives you. So I find that's a really fantastic piece of the puzzle. Sleep apnea will actually drive up blood sugars at night. And so if we see elevated blood sugars, that may lead to some more questions regarding sleep and snoring, and potentially, doing a sleep study to determine if sleep apnea is going on. Stress. And stress is tough because most of us can't just leave the things in our life that are stressful, maybe our kids or our job or our partner or just life, the world that we live in. We most of us don't have the opportunity to hide in a hole to get away from that. But maybe if stress seems to be a trigger for blood sugar dysregulation, maybe we are convinced enough at that point to really work on bringing in some tools to manage stress. So things like deep breathing, meditation, mindfulness, vagus nerve exercises. We have, more advanced programs, something like Primal Trust, which is really a nervous system retraining program. So we have kind of all different levels. Maybe it's going to therapy, so it might help someone make a decision to be really intentional about how they are managing the stress that's coming into their life. Just to make the connection, when we're thinking about cardiovascular health, metabolic health is not separate from cardiovascular health. And so that's why we're talking about blood sugar. We're talking about this hemoglobin A1C, which is the 90-day average of your blood sugar. If you are diabetic or pre-diabetic, or even if your blood sugar is going up, even if you're not, always, you're not pre-diabetic or having an average blood sugar that's too high overall. If your blood sugar is going up a lot, that is a sign that you're having trouble with blood sugar regulation, also a sign that you may be influencing your cardiovascular risk. So cardio and metabolic health are really deeply, deeply intertwined with each other. So when we're thinking about the heart, we're thinking about metabolic health as well, and how they influence each other.
I love that you brought up stress, because I feel like even when I'm looking at people's CGMs, I'm thinking about a patient in particular who was so frustrated. And she was someone who was her job is to get money for a large nonprofit. And we were looking at her CGM, and we would see these giant spikes. And she said, I was at a fundraising event and I drank fizzy water. I had no alcohol, I had no food, but it was cortisol, right? Cortisol causes insulin resistance, and her body felt like she was running away from a tiger.
Mm-hmm.
So her liver, if she doesn't have any food going on, is gonna get glucagon kicked up, and she's gonna start mobilizing glucose stores from her liver because her body thinks she needs to run away from a tiger, right?
Mm-hmm.
I've got to fuel that escape. And so I think that can be really helpful, because I think as women, we're so socialized to, you need to eat less, you need to eat less, you need to eat differently, you're doing it wrong. And sometimes it has nothing to do with food. I also just wanted to shout out, I have had moments in my life where I was really good about doing vagus nerve work, and I was really good about meditating. And this is not one of those moments. And I've been knitting, and I love it. And I would say, if you're having a hard time not looking at your phone and you're getting all that trash energy from your phone, freaking do something with your hands. Get a coloring book, doodle. I'm knitting. I'm just loving it. And even a week in, my husband's like, you need to knit more. You're nicer when you knit. So, what by any means necessary to reduce our stress. So sometimes we're often going to tried and true yoga, vagus nerve, primal trust, like you mentioned, is amazing. Do something with your hands that's kind of mindless, right? And so anyway, knitting for the win for this girl right here. I'm embracing my crone self now. I think, Kate, one thing I'd love for you to talk about is thinking about women and thinking about our reproductive history. And I think sometimes we're like, I had gestational diabetes. And particularly as we mature, we may not be bringing that historical fact to our current healthcare provider. So how does our reproductive health affect our cardiovascular health?
Huge impact. So in our questionnaires, we are asking about things like timing of menopause. We're asking about reproductive history in terms of PCOS, gestational diabetes, those preeclampsia. Those are some things that we want to know about, not just because they're interesting, but because they really do translate into your current health. So for gestational diabetes, if you have had gestational diabetes, you have a higher risk for developing diabetes in the future. And so having that on our radar, even if someone maybe doesn't have some other risk factors, we want to be screening for, blood sugar changes. We want to be looking at insulin resistance. So insulin resistance starts years before we start seeing changes in blood sugar. So to be able to catch someone who has a high fasting insulin, but a normal hemoglobin A1C and normal blood sugar, that is a way to start to intervene early and to think about not just, is your blood sugar okay? Check, we've covered that, but to really start to dig deep and say, how can we address the insulin resistance that is a risk factor for you developing blood sugar abnormalities later on in life? PCOS, for women that have dealt with PCOS, insulin resistance is a very intimate part of PCOS and part of the driver for even the high androgens. So really, really understanding that insulin resistance, treating it early for younger women, being really proactive about diet and movement, and then other support as they need it. Things, their supplements, their medications, we have all of those available to us. And so that's important. For women that go through menopause early, so we think about women with premature ovarian insufficiency, or even women that are just before age 45 for menopause, we know that increases cardiovascular risk because estrogen is protective in terms of cardiovascular disease. And so if we're, giving hormone therapy to a younger woman who has had ovarian insufficiency, maybe she had had her ovaries removed early for some reason, we really want to be mindful to give enough estrogen to be cardioprotective. And so we don't want that woman to just not have hot flashes. We want her to have enough estrogen on board to be providing the protection that her body needs to prevent the progression and development of heart disease because of her early loss of hormones.
Yeah, those are so important. And I think one more that is important is a history of preeclampsia.
Mm-hmm.
So sometimes I'm old enough, I remember when we called it toxemia of pregnancy, then we called it preeclampsia. I think maybe now we call it gestational hypertension. Basically, having a blood pressure problem at the end of pregnancy, typically that patient would start to spill protein in her urine. She might experience changes in liver function. If it gets really severe, she gets something called HELP syndrome when her liver function starts getting really high. And the treatment for that is delivery. So I think it's so important for women to be aware of this so that as they're maybe away from their obstetrician, they might be seeing a primary care provider who's doing their pap smear and their breast exam. They're not seeing gynecology or OB anymore. And they may not be thinking that it's relevant. It's super relevant. So that's so important to make sure that your healthcare team knows about your obstetric history. Thanks for listening to Menopause Rescue. We hope you've enjoyed this podcast and it helps you create some time and space to make this the best half of your life. If you've enjoyed this content, please leave us a 5-star rating and review. This helps other listeners find this resource and rescue and restore their health. If you enjoyed this topic and want to learn more, check out our resource guide for this episode. If today's podcast resonated with you and you want to take a deeper dive, check out my educational resources. We offer basic membership, which is an archive of over 100 videos on menopausal topics ranging from bone health to libido. We add to this archive every month, so the resource becomes richer and richer over time. If you're looking for a menopause expert and live in North Carolina, take our free online class and see if we're a match for your needs. It's called Are We a Good Fit? And is a quick and easy way to learn more about our practice and what it has to offer. Hey, this is Dr. Watson. This is just a friendly reminder that this podcast is for general information purposes only and does not constitute the practice of medicine. No doctor-patient relationship is formed, and any information you get from this podcast is considered educational only. You should make medical decisions with your healthcare provider. The content of this podcast is not intended to be a substitute for professional medical advice. Listeners should not disregard or delay in obtaining medical advice for any medical condition, and they should seek assistance from their healthcare professionals.